Hi everyone. Today we're going to learn about prostate cancer screening. We'll cover important facts and guidelines that can help keep you and your loved ones healthy. Ready to learn something new? Let's get started. Have you ever wondered what the prostate is and where it's located? The prostate is a small gland that's about the size of a walnut. It's found just below a man's bladder and surrounds part of the urethra, the tube that carries urine out of the body. The prostate helps produce fluid for sperm. Now, prostate cancer is one of the most common cancers among men. Each year, about 1.4 million new cases are diagnosed worldwide. In the United States, nearly 3 out of every 10 cancers diagnosed in men are prostate cancer. That's a huge number. Let's dive deeper and find out who might be at higher risk. Who can get prostate cancer? Age is a big factor. Most men with prostate cancer are over 50. Another important factor is genetic ancestry and environment. For example, men of African descent may have higher risks due to a combination of genetic, environmental, and societal factors, including access to healthcare. Also, family history plays a big role. If your dad or brother had prostate cancer, your risk is 2 to 3 times higher. Finally, certain genes called BRCA1, BRCA2, and Lynch syndrome can increase your chances. Knowing these risks can help catch cancer early. Now let's talk about symptoms or signs of prostate cancer. In the early stages, many men don't have any symptoms, but in advanced stages, you might notice trouble peeing, blood in your urine, or pain in your bones or pelvic area. Remember, early detection helps us catch problems sooner. So, how do we find prostate cancer early? One common way is with a blood test called the PSA test. PSA stands for prostate-specific antigen. Usually, normal PSA levels are less than 4 nanograms per milliliter. If PSA levels are between 4 and 10 nanograms per milliliter, there's about a 25% chance of having cancer. If PSA levels are over 10 nanograms per milliliter, the chance goes up significantly, between 42% and 64%. It's also important to remember other things like infections or inflammation can raise PSA levels. So always discuss elevated PSA results with your doctor. Another test doctors use is called the digital rectal exam, or DRE. In this quick exam, the doctor gently feels the prostate with a gloved finger to check for lumps or hard areas. This helps identify potential issues early. Together, the PSA test and the DRE give doctors valuable information about your prostate health. When should you start screening? For most men with average risk, screening discussions start at age 50. But for high-risk men, like African Americans or those with family history, screening talks should start earlier, around age 40 to 45. The U.S. Preventive Services Task Force recommends men aged 55 to 69 make a decision about screening with their doctor. Usually, screening is not recommended for men over 70, but can be considered based on health and life expectancy. How often should you get PSA testing? It depends on your PSA levels. If your PSA is normal, less than 1 nanogram per milliliter, testing every 2 to 4 years is recommended. If your PSA is between 1 and 3 nanograms per milliliter, your doctor will likely recommend annual testing. If your PSA is higher than 3 nanograms per milliliter, further evaluation and referral to a specialist called a urologist who manages prostate health is typically needed. Following your doctor's advice about PSA testing can help detect prostate cancer early. Why is screening important? Early screening can find cancer before it spreads. When prostate cancer is found early, the 5-year survival rate is 100%. If the cancer spreads, the survival rate drops to just 31%. That's why early screening makes such a big difference. But there's also something called overdiagnosis. This means some cancers found through screening might never have caused any symptoms or problems during a man's life. Between 23 to 50% of screened cancers might not actually need treatment. Overdiagnosis can lead to unnecessary treatments, which is why talking to your doctor is so important. Screening has some great benefits. It can reduce the risk of cancer spreading by 30%. Screening also lowers the risk of dying from prostate cancer by 21 to 44%. That's a big deal. Early detection saves lives, but screening does have risks. Sometimes PSA tests show high levels even without cancer. This is called a false positive and can lead to extra tests like biopsies. Biopsies themselves have risks like infections or bleeding for 2% of men. Also, screenings and treatments can cause anxiety and stress. It's important to know these risks so you can make the best choice. We've covered a lot today about prostate cancer screening, so let's quickly review the key points. Prostate cancer is very common, especially in men over 50, African American men, or those with a family history. Early detection through tests like PSA and DRE can significantly improve survival rates. But it's also important to understand the risks, including false positives and potential overdiagnosis. If you'd like more information, check out resources from the U.S. Preventive Services Task Force and the American Urological Association. At Unimed Academy, we're here to help you take charge of your health through live webinars and workshops. Visit our website at www.unimedacademy.com to learn more. Thanks for joining us today. Stay informed, stay healthy, and we'll see you next time.